Ectopic pregnancy begins with a fertilized egg. Usually, a fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg is implanted and grows outside the cervical spine. Ectopic pregnancy usually occurs in the fallopian tube, which carries eggs from the uterus to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes, an ectopic pregnancy occurs in other parts of the body, such as the ovary, abdominal cavity or lower part of the uterus, cervix, which connects to a woman's vagina. Ectopic pregnancy cannot proceed normally. A fertilized egg cannot survive, and growing tissue can cause life-threatening bleeding, if left untreated. Symptoms: you may not see any signs at first. However, some women with an ectopic pregnancy have common symptoms of early or late pregnancy, lost time, chest tenderness and nausea. If you do a pregnancy test, the result will be good. However, ectopic pregnancies cannot continue as normal. As the fertilized egg grows in the wrong place, the signs and symptoms become more pronounced. Early warning of an ectopic pregnancy: often, the first warning signs of an ectopic pregnancy are a small discharge from the vagina and pelvic pain. If the bleeding is in the abdominal tube, you may feel a shoulder pain or a desire for bowel movements. Some of your symptoms depend on where the blood collects and on what emotions are irritating. Emergency signs: if the fertilized egg continues to grow in the abdominal tube, it can cause the tube to rupture. Severe bleeding inside the abdomen may occur. Symptoms of this life-threatening event include excessive headaches, fainting and panic attacks. When to see a doctor: seek emergency medical help if you have any signs or symptoms of an ectopic pregnancy, including severe abdominal or pelvic pain associated with vaginal bleeding. Severe lightness or fainting. Shoulder pain causes tubal pregnancy. The most common type of ectopic pregnancy occurs when a fertilized egg attaches itself to its path to the uterus, usually because the fallopian tube is damaged by inflammation or malformed. Hormonal imbalances or premature growth of a fertilized egg can also play a role. Risk factors: some of the things that make you more likely to get an ectopic pregnancy are: previous ectopic pregnancy. If you have had this type of pregnancy before, you may have had one. Inflammation or infection. Sexually transmitted diseases, such as gonorrhea or chlamydia, can cause inflammation in the tubes and other nearby organs, and increase your risk of ectopic pregnancy. Birth control pills. Some studies indicate that women with in vitro fertilization, IVF, or similar treatment options are more likely to have an ectopic pregnancy. Infertility can also increase your risk. Tubal surgery. Surgery to repair a blocked or damaged tube can increase the risk of ectopic pregnancy. Birth control options. The chance of getting pregnant while using an intrauterine device, IUD, is rare. However, if you are pregnant with an IUD in the area, it may be ectopic. Tubal ligation, a permanent method of birth control known as tightening your tubes, also raises your risk if you become pregnant after this procedure. Smoking. Smoking cigarettes just before pregnancy can increase the risk of ectopic pregnancy. The more you smoke, the greater the risk. Problems in ectopic pregnancy can cause your fallopian tube to open. Without treatment, a broken tube can cause life-threatening bleeding. Prevention: there is no way to prevent ectopic pregnancy, but here are some ways to reduce your risk. Reducing the number of sexual partners and using a condom during sex helps to prevent sexually transmitted infections and can reduce the risk of pelvic inflammatory disease. Don't smoke. If you do, stop before you try to get pregnant. Ectopic pregnancy diagnosis: a pelvic exam can help your doctor identify areas of pain, tenderness, or a mass in the fallopian tube or ovary. However, your doctor can't diagnose an ectopic pregnancy by examining you. You'll need blood tests and an ultrasound. Pregnancy test: your doctor will order the human chorionic gonadotropin, HCG, blood test to confirm that you're pregnant. Levels of this hormone increase during pregnancy. This blood test may be repeated every few days until ultrasound testing can confirm or rule out an ectopic pregnancy, usually about 5 to 6 weeks after conception. Ultrasound: a transvaginal ultrasound allows your doctor to see the exact location of your pregnancy. For this test, a wand-like device is placed into your vagina. It uses sound waves to create images of your uterus, ovaries and fallopian tubes, and sends the pictures to a nearby monitor. Abdominal ultrasound, in which an ultrasound wand is moved over your belly, may be used to confirm your pregnancy or evaluate for internal bleeding. Other blood tests. A complete blood count will be done to check for anemia or other signs of blood loss. If you're diagnosed with an ectopic pregnancy, your doctor may also order tests to check your blood type in case you need a transfusion. Treatment: a fertilized egg can't develop normally outside the uterus. To prevent life-threatening complications, the ectopic tissue needs to be removed. Depending on your symptoms and when the ectopic pregnancy is discovered, this may be done using medication, laparoscopic surgery or abdominal surgery. Medication: in early ectopic pregnancy without unstable bleeding is most often treated with a medication called methotrexate, which stops cell growth and dissolves existing cells. The medication is given by injection. It's very important that the diagnosis of ectopic pregnancy is certain before receiving this treatment. After the injection, your doctor will order another HCG test to determine how well treatment is working, and if you need more medication. Laparoscopic procedures: salpingostomy and salpingectomy are two laparoscopic surgeries used to treat some ectopic pregnancies. In these procedures, a small incision is made in the abdomen, near or in the navel. Next, your doctor uses a thin tube equipped with a camera lens and light, laparoscope, to view the tubal area. In a salpingostomy, the ectopic pregnancy is removed and the tube left to heal on its own. In a salpingectomy, the ectopic pregnancy and the tube are both removed. Which procedure you have depends on the amount of bleeding and damage and whether the tube has ruptured. Also a factor is whether your other fallopian tube is normal or shows signs of prior damage. Emergency surgery: if the ectopic pregnancy is causing heavy bleeding, you might need emergency surgery. This can be done laparoscopically or through an abdominal incision, laparotomy. In some cases, the fallopian tube can be saved. Typically, however, a ruptured tube must be removed. Coping and support: losing a pregnancy is devastating, even if you've only known about it for a short time. Recognize the loss, and give yourself time to grieve. Talk about your feelings and allow yourself to experience them fully. Rely on your partner, loved ones and friends for support. You might also seek the help of a support group, grief counselor or other mental health provider. Many women who have an ectopic pregnancy go on to have a future, healthy pregnancy. The female body normally has two fallopian tubes. If one is damaged or removed, an egg may join with a sperm in the other tube and then travel to the uterus. If both fallopian tubes have been injured or removed, in vitro fertilization, IVF, might still be an option. With this procedure, mature eggs are fertilized in a lab and then implanted into the uterus. If you've had an ectopic pregnancy, your risk of having another one is increased. If you wish to try to get pregnant again, it's very important to see your doctor regularly. Early blood tests are recommended for all women who've had an ectopic pregnancy. Blood tests and ultrasound testing can alert your doctor if another ectopic pregnancy is developing. Preparing for your appointment: call your doctor's office if you have light vaginal bleeding or slight abdominal pain. The doctor might recommend an office visit or immediate medical care. However, emergency medical help is needed if you develop these warning signs or symptoms of an ectopic pregnancy: severe abdominal or pelvic pain accompanied by vaginal bleeding, extreme lightheadedness, fainting. Call 911, or your local emergency number, or go to the hospital if you have the above symptoms. What you can do: it can be helpful to jot down your questions for the doctor before your visit. Here are some questions you might want to ask your doctor. What kinds of tests do I need? What are the treatment options? What are my chances of having a healthy pregnancy in the future? How long should I wait before trying to become pregnant again? Will I need to follow any special precautions if I become pregnant again? In addition to your prepared questions, don't hesitate to ask questions anytime you don't understand something. Ask a loved one or friend to come with you, if possible. Sometimes it can be difficult to remember all of the information provided, especially in an emergency situation. What to expect from your doctor if you don't require emergency treatment and haven't yet been diagnosed with an ectopic pregnancy. Your doctor will talk to you about medical history and symptoms. You'll be asked many questions about your menstrual cycle, fertility and overall health. Menstruation: when was your last period? Did you notice anything unusual about it? Pregnancy. Could you be pregnant? Have you taken a pregnancy test? If so, was the test positive? Have you been pregnant before? If so, what was the outcome of each pregnancy? Have you ever had fertility treatments? Do you plan to become pregnant in the future? Symptoms. Are you in pain? If so, where does it hurt? Do you have vaginal bleeding? If so, is it more or less than your typical period? Are you lightheaded or dizzy? Health history. Have you ever had reproductive surgery, including getting your tubes tied, or a reversal? Have you had a sexually transmitted infection? Are you being treated for any other medical conditions? What medications do you take?